Here's question number 3. Andy will start this one. Question number 3 is this. Part of the driving force behind sheltering in place is to preserve the capacity of our healthcare systems to serve the community. What would be your plan to help Georgia be more prepared and more responsive to widespread medical emergencies, address supply chains, coordination of agencies, and how that will filter down to the local level? Andy Garrison is first.
Thank you for that question. Supply chains, that's pretty interesting because our food supply and our things that we look and go into the grocery store thinking that their shelves are empty, we have no big problem that way. It's just been an allocation issue where we have been pulling everything out of our grocery stores, and then at the same time our big businesses like our theaters, our hospitals, our schools have not been taking the food. So we don't have a supply chain problem or a food chain problem, but we do have a, like you said, a supply chain. We need to reorganize the way that we conduct business, like from the farmers to the table, from the, from the farm to the table things. We need to have, we need to be looking at ways that we can go straight from the farmers to our individual people in our community and bypass the retail. This pandemic has got us thinking everything differently than we have before. And what it's going to take is going to take some innovative people to go back and say, okay, this is what we need to do. We need to establish bona fide routes of our consumer goods to be able to get our goods and services, which are our food, our dairy products, our groceries, to our people in a productive manner. And all that's going to take is reallocation. And we have our governor working on that. We have Sonny Perdue working on that, and we have our Commissioner Gary Black also working on that.
Thank you, Andy. Stacy Hall is next.
Thanks, Tim. This is something I'm very passionate about. As county commissioner the last 4 years, I've worked very intimately with our local hospital. Spent a year and a half as the chairman of the local hospital. So I've got a great relationship with a lot of hospital administrators. And I spoke about this issue with the lieutenant governor, several House representatives and state senators as well. Certainly, I'll try to, I may forget one of the parts of the questions, but I'll try to go down the list. Logistically, I think we've got to do a better job of communicating with the various agencies down to the local hospitals, local rural hospitals. And they're treated differently. Rural hospitals don't have or do not have a lot of the resources, obviously, that the local bigger systems have. And the communication channels may be a little bit different as well. So I think that it is very important for at a state level to make sure that we're able to communicate and plan logistic channels and communication mediums to the right sources. One of the things that happened early on in the COVID-19 is we were getting bombarded by so many different federal and state agencies that were trying their best to share information with them, but it was hard to decipher what was important, what was timely, what was relevant to us. What's relevant to New York City, what's relevant to Atlanta was not relevant to us. So I think, again, being able to streamline that information, being able to get it delivered in a timely manner, and also make sure that there are a checklist for these type of issues related to logistics and equipment and things of that nature. And just it doesn't only affect hospitals. We're talking about EMS, our EMS department, our fire department, our sheriff's department, all of our public safety personnel have been working enormously hard at great sacrifices, along with our nurses and doctors at the hospital. So all of those first responders, all of those frontline personnel have got to be tied into the communication loop as we talk about logistics and disseminating important information from those various agencies. So again, this is something I'm absolutely red hot passionate about. Thanks for asking that question, Tim.
Thank you, Stacy. Tricia is next.
Well, thank you for the question. When you look at the logistics of this, as well as the supply chain of what is needed during the COVID-19 crisis, you can't go forward without saying a huge thank you to the people who are stepping up to the plate, who are thinking outside of the box and providing innovation in the industry. From the people who, from the companies that have stopped production of their normal everyday production line to produce PPEs, to the teachers at the local high school who are using 3D printers to manufacture extenders for ear extenders for the masks, to the people with sewing machines at home who have purchase bolts of fabric to go back to their houses and yards of elastic in order to make homemade masks. People have come together in order to address the evident issue of having a lack of a supply chain. You know, I didn't live through World War II, but I can imagine Rosie the Riveter. This is what people did when they faced a crisis. They found a solution to the problem. I think that our rural hospitals, as well as our hospitals throughout the entire state of Georgia, are going to look at this as an opportunity to create a contact list of people in the future in case we need to have those innovative designs and innovative structures in place. It will enable us to say, okay, this type of problem, how are we going to face this if it comes back in the wintertime? Apparently this virus doesn't like warm, humid climates, but it does thrive in a more cold environment. So we need to be prepared to do that. Well, the way that we hit that supply chain is we look at what has worked now, what has worked today, and we build that bridge. I keep going back to it. We build the bridge between our local, our county, and our state government. Yes, there's a lot of information out there, but we as individuals have been able to help ourselves. We have stood up, we have provided our own resources and our own gifts and talents to be innovative in order to help our local hospitals. It doesn't matter what we're doing. We have all worked together, and this is a great opportunity to look at how we can address the supply chain issue moving forward.
Thank you, Tricia. Lee Moore is next.
Well, I feel like first we should take a hard look at where we weren't prepared and understand why we weren't prepared. And then we look at how to implement policies so we're prepared in the future. Georgia must have a robust testing program ready and available and in place in case of a rebound or any kind of future breakout of this virus. We can do this by utilizing some of the great companies, and I'm all for keeping things in-house, so to speak. We have great companies and businesses in this state, and we have great university system in this state. Utilize these companies in the university system to help us be ready for a testing system if this breaks out again. Secondly, we must make sure our medical professionals statewide have the required personal protective equipment available and be able to quickly supply this sufficiently to them and critical medical equipment in the case of another surge. We must be ready to make sure that our hospitals are prepared and able to handle an outbreak and the surge with the ICU beds that come with that as well. And in my opinion, finally, I feel like Georgia, we must have the ability to protect the health and safety of our healthcare workers and personnel and be able to monitor the conditions and immediately take steps to limit and mitigate any future outbreaks by implementing protocols for social distancing policies that will protect our fellow citizens.
Thank you, Lee. Bo Hatchett is next.
You know, I think this is a great question. It's very relevant for this district. You know, this pandemic is nothing we were able to, nothing we could have expected. But one thing I've heard from the medical professionals, I've heard a lot of concerns. Number one, rural hospitals tend to be the last hospitals that get attention from the government and from companies as far as resources. For example, you know, my dad's a physician and he's tried to order COVID-19 tests, but he has been unable to have these in his office because they say that our area is not a hot spot yet. However, in New York City, I heard today that they've been testing cats, and I just don't think that's a wise thing to do. And I think, you know, as a state senator, you need to stand up for your district and you need to help your district prepare and get the resources they need. You know, that's one thing that I've been doing over the past several days. There's a factory in Raven County, gasket guy factory. Sean Brottenton is actually the owner. And what he's done is he's rebuilt his factory to supply, to make face masks for a surgical mask for the hospital. And I reached out to him, and what we've been able to do is he's coordinated with local hospitals to donate 1,000 face shields a week to rural hospitals in Northeast Georgia, while upping the production at his factory. And his goal is to hit 1 million masks by the end of May. And he's been able to retain his employees, and he's created 40 new jobs for employees. And that's what a state senator needs to do. It's to look at a problem and to find a solution for the district. And that's what I plan to do.
Thank you, Bo. Wrapping up round 3 is Dan Gassaway.
I'm going to use the option to ask you to repeat the question. I've been listening to all the answers and I've lost track of the question. So tell me again your specific question, please.
No problem, Dan. Part of the driving force behind sheltering in place is to preserve the capacity of our healthcare systems to serve the community. What would be your plan to help Georgia be more prepared and more responsive to widespread medical emergencies, address supply chains, coordination of agencies, and how that will filter down to the local level?
Well, as a state senator, you're going to be dealing with policy and laws. So the executive, the Governor Kemp, who's our executive now, will, I'm sure, come forward with some proposals that the legislature will consider starting in January. I think what we have to remember is this event is changing our country and our state forever. So a lot of these proposals are going to be pushed by liberal organizations. We have to, as a state senator, be ready to evaluate what's good for your district. We don't want to give away our freedoms, but we want to make sure that we are prepared for the future. But I don't know that we really have supply chain issues. We just have a virus that we weren't ready to test for. And I think Lee Moore's answer to that was really good. We've got to be ready to test for pandemic viruses in the future. There's going to be some policy coming forward. There may be some legal proposals that maybe mandate testing. I don't know, because I don't know what's going to come in January, but that's what your state senator is going to be assigned with, is deciding what is in the best interest of the people he represents and protecting their rights and their freedom. But, you know, I don't see us having a real supply chain issue, but thank you for the question.
Thank you, Dan. That concludes round 3. We're halfway home. Take a deep breath. 3 more questions and a final conclusion, final statements here is we'll get right in. We're halfway pretty much where we need to be, 7:14, about 45 minutes into it.